All right, we're making another kind of similar video, but the last time we talked about psychology and essentially emotions and the root of our more aversive emotions, and how just simply trying to treat the symptoms to make the symptoms go away, whether that be, irritability or fear, anxiety, or sadness and depression or despair, doesn't really get down to the root of the problem. You may be able to sort of blunt or change the symptoms, but you can't really affect a cure, and that's sort of what we tend to see in psychiatry and psychology, is that treatments are, in the range of ineffective to 20 plus almost 30% effective in terms of symptom management. So we're going to, talk more about the physical today. So, treating migraines and headaches, muscle tension headaches, myofascial pain, chest, atypical chest pain, gastroesophageal reflux disease, irritable bowel symptoms, interstitial cystitis, things like Ehlers-Danlos syndrome, and now we're getting into other syndromes, postural orthostatic tachycardia syndrome, things like that. We tend to target the symptoms, and again, we don't get to the root. So if we use our little ferns, for example, again, let's come into this little cluster here and kind of see what is underneath each one of these things popping up to the surface, which visually we can see quite well. So let's take this guy and say he might be a bit of a migraine, and dig down below the surface a little bit and see what we might find underneath here. So get down to sort of the base here of the symptom, tiny root, nothing too extremely exciting here, but let's follow the root as far as we can. Yeah, it's a deep one. It's just going straight down. So anyway, kind of a tiny root there. So let's maybe look at sort of myofascial symptoms here. Neck pain, back pain, which is the majority of axial pain, right? It's not structural, it's physiologic, and it's coming from the muscles and connective tissue, so we call it myofascial pain. And we dig down here and see what we find at the base of this little guy. Oh, I broke him off. Okay, there's a little root down there. Let's try this one here. Let's say this is low back pain. It's a little bigger. See if we find anything down here at the base of myofascial low back pain. So yeah, it's tracking. So it goes that way a bit. It broke there. And then it's coming down this way. It's getting a little thinner here, but still confluent. If I don't break it. Oh, shoot. So it keeps running down here. It keeps going that way. So there's our low back pain. We can do some facet blocks right there. Radio frequency ablation, numb that up. But we haven't treated the problem. It's the root. And what is the root? It's your threat load. All the different threats. Generational, historical, physical, emotional, social, mental, cultural, spiritual, existential, on and on. Okay, what's this little guy? I don't know. This guy might be a little tiny bit of irritable bowel. Let's see. They tend to all cluster together. His root broke off as well. So when the symptoms go on and on and on, and the root is never being addressed, then things can kind of advance into other degenerative conditions. It can be degenerative arthritis, degenerative spine disease, but more importantly, the neurodegenerative disorders and things like dementia, Parkinson's, schizophrenia. So let's take a look at this one. Let's say this one is a dementia, and it's big. It's been growing a long time. Let's see if we can even get down to its root. Maybe extremely deep. Yeah, wow. It is way the hell down there. Kind of finding something here. I think it might break though. Try not to break it. Try to unroof it a little bit. It's running pretty dang deep though. Yeah, broke off. But anyway, that root probably runs way down there that way. So let's come back, to this little guy and see what's down here. Let's call him degenerative disc disease. I'm not sure it's really a disease per se, but it is a degenerative disorder. Yeah, these big ones come from way down deep. He broke off. Okay, let's see if we can find one that maybe the root isn't running quite as deep. So there's a big root there, and it's going to run this way underneath this bush. That may be hard to keep it from breaking there, but maybe it will. Keep it going. Yeah, it's starting to dive deep now. You can't really pull it out, but went under the bush. So anyway, you can kind of get the point. If we don't treat the threat load, if we just keep picking these things off at the surface, treating the symptoms that we see, and we don't get down and explore beneath that level down into the level of the root, we're just not going to make a lot of progress with providing care for people. We're going to waste a lot of money and have not really very great outcomes. Oh wow, that one goes under the rock. Oh, it's going down this way quite deep. Oh my. Going underneath all these little guys. It's still going. There you can see that's a threat load that needs to be uncovered and treated if we want people to get better.